I'm Dr. Kevin Christie. I'm going to talk a little bit about active release technique, or ART, what many people call it. It's a soft tissue based treatment that is a little bit different than massage because it uses a couple of things that are different. One is that it's a movement based treatment, so there's a lot of activity with the patient involved. They're not just going to be laying there. So we're going to be having some movement based treatments to lengthen the muscle from a short position to try to break up any adhesions that might occur in the body. This is one of my patients here. We're going to do some shoulder treatment using active release technique, or ART. One of the problems is a lot of the patients seek orthopedic care or primary care physician, which is a proper step, but if it's not a structural issue, a lot of times they don't get the treatment that they need. So a lot of times with the shoulder, it'll be more of a soft tissue thing, like muscles or the rotator cuff, things around the shoulder that are causing the pain that they're feeling. So with ART, we first do a full biomechanical assessment of the shoulder to determine if there is no underlying structural issue, like a torn labrum or degeneration, things of that nature. And from there, we're going to try to figure out what muscular imbalance might be occurring at the shoulder that is causing the pain. And when we treat the shoulder, there's a lot of different types of positions we're going to go in, but we're going to try to free up some of those restrictions that we might find that are causing the pain. And when I say restrictions, we're talking adhesions, trigger points, things of that nature. And so you'll actually palpate that area and it'll show up tender to the patient and sometimes reproduce their symptoms, which is actually a good sign for us. So what I'm going to do here is the first move. Take your arm up here for me. I'm going to get onto the posterior or back part of the shoulder here and get on the rotator cuff. From here I'm just lengthening that posterior capsule there. Is that a little tender there? Yeah. When I evaluated him, this muscle was showing pretty tight and altered movement, so I'm trying to free that up. So right now the muscle that my thumb is contacting is in the shortened position, and then from here I'm lengthening it. We should do about 3 to 6 passes, pass being just the movement that I'm talking about, and then we move on to the next structure or the next movement. Okay, what I'm going to have you do is we're going to go right across there. Take your left arm, your right arm, grab your left arm, and pull all the way across for me, and come back. So I usually demonstrate to the patient first. Okay, go ahead. The best part about active release technique and what separates itself mainly is the diagnostic and biomechanical assessment that you have to do to try to figure out what is going wrong. Active release technique is used to treat muscle conditions, nerve issues, fascia, ligaments, tendons, things like that. Any type of overuse strain that may occur in the sedentary person or the active runner, football player, baseball player, anything you name it that can be overuse. Active release technique does a really good job in treating that, and it's an alternative to some other techniques out there, and it's getting good name recognition for itself.
Being a ball player, our bodies are put through a great deal of stress. I think that because of it being a daily routine, we don't really have the time to wait for the swelling to go down, or wait for our bodies to take the 4 to 6 or 8 weeks that it takes to heal some of these injuries, and you can kind of come in and get some of those things worked out and get results almost immediately.